CDC has added 6 more signs to its official list of COVID-19 symptoms.
Yeah, the initial symptoms were just fever, cough, and shortness of breath, which frankly was so broad. I think a lot of people were a little thrown off by it, right? So we are talking about what symptoms we should be looking out for. And Heather, they're just learning more, right?
Exactly. With more time and more testing, quite honestly, as they know who are the patients are that have this versus maybe had the flu in the beginning of March.
Sure.
So here are the 6 symptoms. You mentioned already the fever and the cough. Right now they've added chills, they've added shaking with chills, muscle pain, headaches, sore throat, and a kind of a strange one, but that loss of taste or smell. You may have heard some people who have had COVID-19 talk about this idea. One man I heard had said he kept putting cayenne pepper on his food, and he realized when he was eating it, he was just feeling the eating sensation rather than any of the pepper. So it's an intense lack of smell or taste.
Yeah, and that's a good symptom, I think, because it's so noticeable, right?
Exactly.
Yeah.
But it's not that common.
Right.
So here's the problem, is that I went back and I watched all of the interviews that we've done with people who have recovered from COVID-19. And you went from one woman who said, I felt like my skin was on fire, to a man who said, you know, I just didn't feel very good. You had someone who said I couldn't taste or smell at all, and then someone who said, I was fine. I had a full appetite. Some had bad shortness of breath. Others were breathing just fine. So it can be a little tricky to know what to look out for.
I mean, it's sort of like that with the flu, though, right? Like you can have a flu with a fever, you can have a flu without a fever. I mean, I think people are looking for like a checklist that says check, 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 check. I got it. And that's just not how these things work with anything.
No, in fact, we talked with a physician who is screening patients for COVID-19 over at Hennepin Healthcare, and she made that same analogy. It's not like you check ABC and say, yes, now I should call my doctor, I have it. She said what you really need to do, if you get any sudden symptoms, so suddenly you get a shortness of breath, suddenly you get that fever or that sore throat, you should get tested. You should call your doctor, you should get tested. I said, well, you know, headache is on the list, and headache can mean a bunch of different things, especially
like
at
an
this
hour
time.
Watching me on this show could cause that for anybody.
But she said, if you have a headache, call your doctor. We'll walk through it with you. We'll look at, you know, what interactions have you had with people that have tested positive or that maybe had some of these same symptoms, and then come on in and get a test. But now at Hennepin Healthcare, starting on Friday, if you walked in with any symptoms, and this is a lot of these hospital systems around now, you'll get a test.
You'll get a test. Yeah, so it's so different now, right?
Right.
And that's part of the benefit of adding these extra different symptoms in there.
Right.
Because you can get a test now. And for a long time, I know you guys are hearing this and you're like, for months they've been telling us, if you want a test. No, like people couldn't get a test. You had the symptoms, you couldn't get a test. Now you will be able to, and that's you know, it's important for people who have those symptoms to find out.
Yes, and they have to find out, and then once they find out, then they'll get their test, they'll lock it down, they'll get interviewed. I mean, there's a whole series that starts that afterwards. But that they told me that you would get the results within 24 hours.
Good. All right.